Services meeting today on Tuesday, May 5th. I'd like to call the roll. Councilmember Benedict.
Present.
Councilmember Glover.
Present.
Councilmember Hall. Councilmember Hall. Councilmember Porterfield.
Present.
Councilman Pulley.
Yes, ma'am, I'm here.
And Councilmember Welsh. Councilmember Welsh. Okay, we do have us to begin. Can someone make the motion that this committee meeting agenda constitutes essential business of the Metro Council and that meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans in the light of the COVID-19 outbreak as ordered by the governor?
Make that motion.
Second.
Thank you very much. So we're going to go on with our agenda. Our first resolution is Resolution 2022-99, Hurt, Welsh, and Stiles. It approves an Amendment 1 to a clinical affiliation agreement between the Metro Board of Health and Lipscomb University to provide clinical experience opportunities for its graduate nursing program students.
Motion.
Second.
I should have asked for a guest. Are there any guests? Is Mr. Sharp or any guest here? Okay, there being none, then it basically speaks for itself. Clinical experiences for those students to be able to have an opportunity as they are nursing students at Lipscomb University. Is there any discussion?
So moved.
All in favor?
Aye.
Aye.
Any opposed? Great, thank you very much. The second resolution, we got bills on second reading. In Bill 2020-278, Benedict Mendez and others, and I do have a letter from Councilmember Mendez. It approves a lease agreement between the Metro government and City Road Chapel United Methodist Church for office space at 701 Gallatin Pike South, in Madison, Tennessee. Is there a motion?
Moved.
Second.
Thank you. It's been properly moved and seconded. Any discussion? There being none, all in favor say aye.
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 Any opposed? Great, thank you. Our second bill is a bill from 2020-285, Councilmember Stiles, Toombs, and others. It's an ordinance requiring employees of essential businesses interfacing with the public to wear appropriate face coverings. Councilmember Van Rees has a proposed amendment. Is she on the line?
Moved.
So I don't have the amendment before me, and she's not here. Is there a particular order in which you can't move the amendment without her? Can we, Councilman Glover? Councilman Glover.
Yes. Is it possible to defer this one meeting in order to get the amendment? Because I think somebody may be able to bring the amendment, but I don't know what the committee.
Okay, so can someone make a motion to defer?
I'll move to defer one meeting.
Second.
Thank you. Any discussion on it?
I have a question, Council Lady Hurt. If the amendment is deferred, does that mean that the original legislation also has to be deferred?
Yes.
I think the
it
motion
does.
was to defer the bill.
Yes, it does.
That was the motion.
Excuse me, I have a little concern about that because I don't know that it's fair that we defer someone else's bill because the person with an amendment isn't able to attend the meeting. So I just have a little concern with that.
Well, I need a point of order because I'm unaware of what is actually supposed to be the proper thing to do in a situation like this.
Well, Madam Chair, may I?
Yes.
I'm moving to defer one meeting. Otherwise, I'm voting no on this because I don't see how we enforce it the way it's written. And so I'm giving the opportunity to see the amendment and hear from the proposed amendment, the sponsor of that. So that's my reasoning for asking to defer one meeting. Or if you want to go ahead and vote up or down, I'm voting no on the bill. So I'll vote yes to defer one meeting, or I'll vote no up or down.
Okay, so I don't know what's proper, what actually is the proper move. Because we have a proposed amendment, we have to vote up or down on the proposed amendment. Is that not correct?
No, ma'am, this is John Cooper. You don't actually have to consider the amendment. The committee recommendations on amendments are not required. There is a pending motion to defer on the floor, so that will have to be disposed of one way or another before moving forward.
And Chair,
Yes.
the sponsor of the amendment is trying to get on this call. She's been trying and is working to get on the call right now.
Okay.
Nancy's here. Hi. Sorry for the delay, Chair Hurt. I know we can all understand the bouncing back and forth issues. I understand that you are on my proposed amendment on 285. Is that correct?
Yes,
No.
it is.
No, we're not on the amendment. There's been a motion to defer the bill. So I think what we got to do is deal with that now.
I guess you're right. Yes, we do have to.
Okay, I would have liked to put the amendment on it prior to deferral, but
We haven't,
Right.
no.
So let us, we hadn't voted yet, so let us vote on the motion to defer. It's been
Got it.
properly moved. Has it been seconded that we defer?
Madam Chair,
Yes.
so I think what would be easiest is I'm gonna withdraw my motion to defer, and let's hear what the amendment is, and then I can decide, and we can all decide if we want to vote yes or no on this.
Okay,
That's good.
thank you. Thank you very much. So Councilmember Van Rees, would you please give us an explanation about your amendment?
You want to
Thank
do the
you.
amendment first, Councilmember Hurt?
We need to go back and do a motion on the bill.
I move the amendment.
Second.
Okay, it's been properly moved in a second that we vote on the amendment. Now we can ask for the discussion.
thank you very much. I was very excited about the enthusiasm on the intent of this particular bill. It may or may not have been better as a resolution, but if we move forward as a bill, I wanted to make some clarity on the explanation of how to use the fees coverings, and offered this substitute as a amendment to clearly indicate that it was offering the execution of the intent as it relates to the CDC guidelines. And so I have offered this amendment to make it clear that when if we vote in favor of this bill, that it would be based on the CDC guidelines. So that was the intent, and I look forward to discussion.
Okay. So, does anyone have any discussion that they'd like to share? as it relates to the explanation regarding the amendment?
Chair, this is Councilwoman Benedict.
Uh-huh.
So I would suggest to the committee, I support this amendment, and I would suggest to the committee that on the floor, we have the opportunity to put this in front of the entire council with the amendment. But I would suggest that these are CDC guidelines, and so I'm in support of the amendment. And I hope that we can come out of committee with the amendment attached to the bill so that then a discussion could take place on the floor. I would appreciate everybody's support as well.
Okay.
Thank you, Chair.
Okay. Thank you. Any other discussion?
From what I can see, the amendment just simply articulates the guidance from the CDC as to the cloth coverings. They should fit snugly, be secured, include multiple layers of fabric. I'm sure that's cut right out from the CDC manual. Is that not right, Councilor Van Rees?
That's correct. In addition to allowing for breathing without restriction, which was direct feedback from my constituents in regard to the guidelines, making it clear that if there is a medical reason to not be able to wear one, that it was clear that was included.
Okay.
Okay.
I don't see anything on the amendment that addresses that last point you made.
That's the allow for breathing without restriction. Is that bullet point, and that's straight from the
Allows
CDC.
for breathing without restriction. That addresses what you were talking about.
Yes, and that is straight from the CDC guideline.
Okay.
Councilman Glover, did you want to have anything to say?
Yeah, I can't figure out how to raise my hand. I'll deal with that after this meeting. But here's what bothers me about this bill in totality, and that is
We're on the amendment.
I don't know how we would enforce it. And so, I mean, if we just keep adding more and more and more enforcement out here, I think employers realize what they need to do. And, if customers don't feel comfortable going in, if they're not wearing a mask, that's one thing. But for government to dictate this is what you will do, that bothers me. Because it's just, number one, I don't know how we enforce it. Number two, if we get enforcement, what are we going to, what's the penalties? What are we getting into here? So, those
Fair point of order.
Yes.
Excuse me.
Yes.
Aren't we on the
Councilwoman
amendment?
Styles.
Yes, we are.
Can
Just a
we go on the
second.
amendment and then talk about
We are on the amendment.
Not get myself.
So, Councilman Glover, is there anything that you have concerning the amendment that has been proposed?
not particularly, no.
Okay. So now, any other discussions regarding the amendment?
Chair Hurt, can you
Yes.
hear me? I've not been able to get in, and I can't tell if anyone can hear me right now.
This is Councilmember Styles.
Yes, thank you.
Councilmember Styles, yes, we can hear you.
So-
But just a second, we're on the amendment which has been proposed by Councilmember Van Rees.
Yes, and I came in on her last two sentences, so I was wondering if I could be refreshed on what her amendment is.
Chair, with your permission, I'd be happy to consolidate. The amendment is offered in the amendment packet. It's very simple in regard to definition of face coverings required and how they are used based on the CDC guidelines. There are 5 bullet points. 1, to fit snugly but comfortably against the side of the face. 2, to be secured with ties or ear loops. 3, to include multiple layers of fabric. 4, to allow for breathing without restriction. And 5, to be able to be laundered and machine dried without damage to the shape. Those are the 5 suggestions in regard to the proper use of a face covering from the CDC. I wanted to offer this friendly amendment so that if it is passed, that it's clear as to the instructions. That's the only reason for the amendment. Thank you.
Okay, thank you.
Thank you.
Do you have any questions, Councilmember Styles, in regards to the amendment?
I think the only statement that I would have, and thank you very much, Councilmember Van Rees, if it's a mask that someone's using that is typical, it's a typical surgical mask, that is not one that can be laundered. It could be microwaved, but I wouldn't mind putting some verbiage in there to go with that, so people don't make the mistake of getting those.
This language is straight from the CDC guidelines, and the intent of the amendment is to offer CDC guidelines for continuity.
So I do know that the governor has decided to distribute some cloth masks. Do you know if he is utilizing those same CDC guidelines in his distribution for employees?
I would make a reasonable assumption in that regard. I defer back to Council Member Benedict's offering for this committee to proceed with this bill as amended, so that the full body can have this discussion.
Okay.
Chair Hurt, Councilmember,
Yes.
your hand up.
Excuse me?
Councilmember Welsh has her hand up to speak.
Okay, Councilmember Welsh.
Thank you, Madam Chair. I apologize for I was part of my other committee meeting and I missed this discussion about the entire bill. I wondered if, as I could ask for a point, this might have been already answered in earlier discussion as I came in at the same time Council Member Styles did. How long is this bill to be in effect? Would this be, and again, if this question's already been answered, I apologize. But does this?
We're on the discussion on the amendment now.
Move through,
Right.
the rephasing in, or did it have time frame, I guess, was the question?
Councilmember Welsh, we're actually on the amendment itself.
Yes, I know.
And I'm getting some kind of feedback. Okay. Councilmember Welsh, we are on the amendment that's being proposed by Councilmember Van Rees. Do you have any concerns as it relates to the proposed amendment?
No, I don't.
Okay. Are there any more discussion on the proposed amendment? There being none, let's take a vote. All in favor of the proposed amendment, say aye.
Aye.
Any opposed? Okay, the amendment passes. Now, may I have a motion on the bill itself?
You've already had that. So the bill's now amended.
The bill is amended. And so now, as the bill amendment, is there a vote for that? All in favor, say aye.
You have any more discussion? Aye.
Okay, I apologize. I am just really confused right now.
Right now, Council, Madam Chair, the bill was previously moved. We just moved and voted on an amendment. So now there is time for discussion on the bill as amended, if you'd like to entertain that.
Okay, thank you. I would like to entertain discussion on the bill as amended.
Madam Chair?
Yes.
This is Councilwoman Styles. Unfortunately, my computer is frozen, so I'm unable to use my raised hand.
I couldn't see it anyway.
Oh, okay. I did hear, I believe it was Councilmember Glover had a question regarding the bill.
Yes.
Did I hear from him?
Councilmember Glover, would you like to share your concerns?
Yes, Madam Chair, I'm sorry. I'm like you, were bouncing between bill and amendment, so I apologize for talking about the bill, which you shouldn't have. So I have a challenge. I'm not probably going to be supportive of this. And the reason being is because I don't know how we enforce it. Number one, we're already way short on the number of people to try and enforce things that we can't get enforced as yes in so many other areas. And I think businesses understand what they're supposed to do. Ultimately, the real decision maker will be the customers on whether or not they feel comfortable going into an establishment or not. So I don't like government regulating down this granular. And so for me, I'm opposed to it. If everybody else wants to vote for it, that's fine. But I still think we have a major problem trying to figure out how we actually enforce.
Okay.
Councilwoman Hurt.
Yes.
This is Councilwoman Porterfield. I know you can't see the hands. May I be recognized, please?
Yes, please.
Thank you so much. Attorney Cooper, a point of clarification, please. Can this be amended on third reading?
Not without suspending the rules, no, ma'am.
Okay. I'm supporting this legislation. I will ask that the committee please support this legislation. If there is an amendment that needs to be made to address the enforcement, I ask that we support suspending the rules on third reading to amend the legislation. But I think it is important for us to do our due diligence to try to keep our community safe. I just left the store before I came into this meeting, and I was one of the only people that had on masks. Employees are not wearing masks. Businesses are not mandating their employees to wear masks. And if we are going to get a hold on this, we do have to make sure that we're doing everything we can to protect the public. So thank you to Councilwoman Stiles and Toombs for bringing this legislation. Thank you, Councilwoman Van Reese, for bringing the amendment. I'm going to support it, and I ask that my colleagues do as well. Thank you so much, Chair, for acknowledging me.
Absolutely. So, yes.
This is Councilwoman Stiles. If I may respond to both Councilmember Glover and Councilmember Porterfield.
Mm-hmm.
I did have a conversation with the Department of Health, Councilmember Glover, in regards to enforcement. I spoke with Dr. Caldwell, and in terms of enforcing this, right now, to Councilmember Porterfield's point, many stores, and as we are in the Southeast in one of the largest hotspots, there are many people that are not adhering to the suggestion of wearing a mask. And so while I understand not wanting to be so granular, we are at a point where we really do need to be in order to protect people's safety. It's not about a personal freedom issue. And I would encourage my peers to please support this bill. This protects our frontline workers that are making a sacrifice daily to interact with the public in order to provide us with necessities.
Thank you so much. Attorney Cooper, could you share what the difference in this would be had it been a resolution as opposed to the bill? And if now that it is already put forth as a bill, is it any way that it can be amended and moved over to a resolution where we know it wouldn't be enforceable, but it would be more than a suggestion, being that it went through the council process?
So it could either be a memorializing resolution asking the health director to amend his order to include this requirement, or it could be an ordinance. Right now it's in the form of an ordinance. It could be, subsequent legislation could be filed as a memorializing resolution, but this could not be amended to that.
Okay.
Chair Hurt, I have two council members with hands up. I think Council Lady Porterfield still has her hand up from a previous comment. I have Council Lady Welsh and Council Member Pulley seeking to be recognized.
Okay, Council Lady Welsh.
Thank you, Madam Chair. And I too apologize for speaking on the bill before when we were on the amendment. I didn't realize we were on the amendment. My question is perhaps Councilwoman Stiles can tell me, is there a date at which this ordinance would no longer be in effect? Or is this something that is just open-ended and ongoing?
Yes, this is in effect as long as we are under a state of emergency.
As defined by the state?
By the executive, by our local order.
Okay. So this ordinance would be removed as we went through the phases of reopening as outlined by the mayor's office?
Potentially, I think that we would need to look at if it was something that we wanted to keep in place beyond that, beyond the phases, that would be something to be discussed. Is that correct? Attorney Cooper? Something that we could shift?
Ordinance, it depends on what the phasing approach is. If that is an amendment to this order, then it would apply. If there is no order regarding the phasing, then it would not.
I'm so sorry, you were breaking up at the beginning of your answer. Could you repeat that?
If the order is amended to incorporate the phasing aspect, then this ordinance would continue to apply. If the order goes away and there is no order for the phasing, then the ordinance would cease to apply.
So we would need to make that amendment so it would continue beyond necessary.
Yes, I mean, the bill would have to be amended if you're going to have it extended beyond the state of emergency order.
So, Council Lady Styles, it does sound like you might want to put some timeline on this and state the designated time and not just leave it open-ended. And maybe that would require another amendment. And we do still have time for us to be able to amend it, being that we have a third reading on this, correct?
If the rules were suspended, yes, ma'am.
Okay.
Madam Chair, I believe that is exactly what I am going to do. So, thank you.
Okay. So she would need to suspend the rules at the third reading and not tonight?
She would either need to defer the bill tonight or suspend the rules on third reading to try and offer another amendment.
Okay.
Thank you, Attorney Cooper.
So what's your posture on it? Would you like to suspend the rules on the third reading, or you want to defer tonight?
I think I want to suspend rules on third.
Okay.
Council Lady, you still
Councilor Pulley,
Yes, I have a brief question, and my question is for Attorney Cooper. What does this bill do that the governor's order does not?
Well, the governor's order exempts Metro. So the governor's order has no impact on Metro except as it relates to churches.
Except, you broke up, what did you say, except as it relates to what?
To places of worship.
Okay. All right. Thank you.
Okay. Any more discussion? Yes.
I have Councilman Glover with his hand raised.
Okay, Councilman Glover.
Yes, this is for the Attorney Cooper, please. So, Mr. Cooper, should the governor retract the multiple or the 5 metropolitan areas in Tennessee because everything is too mixed up and there's really not a clear path being established, especially given the size of the area that we're in, then what would the effectiveness of this be? And if we roll the dice on suspending the rules on third and 2 people object to it, then what happens? The bill just goes forward, correct?
To the last point, that's correct. If the rules weren't suspended, it would just go forward as is. As to the governor's order, if the governor amended the order to take out the exemption for Metro and the other counties that have their own health departments, then there is an AG opinion from last week that said that the state order would preempt any local orders or restrictions to the country.
I'm sorry, Madam Chair. It was breaking in and out. Maybe it's not on others, but it was on mine.
Yes, Councilman Glover, because it was kind of baffled of what you were saying as well. I couldn't get clearly what your statement was.
What I was asking was if the governor basically retracts the giving the 5 metropolitan areas, then would it overrule this, and then the state would take over at that point as far as what the rules would be. That way you've got a consistency throughout the state.
Right, correct. So, are there any other discussions, comments, issues that need to be brought forth as it relates to this bill? Any other discussion? So I think we probably need to take a roll call on the bill. So are we ready for the vote? Councilmember Benedict.
Aye.
Member Glover.
No.
Councilmember Porterfield.
Yes.
Councilmember Pulley.
Aye.
Councilmember Welsh.
Aye.
And Councilmember Hurt is aye. 5 in favor and 1 against. The bill passes. Thank you very much. Let me just offer, before we adjourn the meeting, I just wanted to give some updated information that the Vice Mayor had requested of me last meeting, and he's asked me to do it this meeting. But I know we all are receiving the daily informations from the Metro and state, but just wanted to go over it. Our confirmed cases for the coronavirus is 3,222, 131 new cases overnight, 32 deaths. Last night we had 5 deaths on yesterday, and 1,630 recovering. As far as the state, there are 13,624 confirmed cases, 122 cases that they indicated were overnight, 226 deaths, and 6,300 recovered. There is also information as it relates to Vanderbilt and the HEN group. Mary Pat Teague from Vanderbilt shared some information regarding the LGBTQ Americans and its impact from the COVID-19. And it was really interesting because that's a vulnerable population with a higher prevalence because they have underlying conditions like heart disease, HIV, asthma, and so forth. And they are also less likely to have health insurance. And one other thing that was very startling was the fact that 17.9% have reported losing their jobs and 30.2% have reported a reduction in their jobs, which I think we have to be very mindful of these vulnerable populations and the impact that it has on those communities. And I think thus is why it's very important that people do wear masks. Also, I may have mentioned at the meeting last time that MDHA was going through some screenings, and they have included garnered properties, those senior facilities where 50 people were screened, 19 tested, with 1 positive and 18 negatives. Edgefield had 65 screened, 57 tested, and they all were negative. Hatley had 65 screened with 50 tested, and 35 are negative with 15 tests pending. And last weekend they were at Vine Hill, and they had 43 screened with 41 tested. Is there anything else that need to be discussed or reported?
Madam Chair, Nancy Van Rees checking in. I want to thank you for mentioning that report on behalf of the LGBTQ caucus of the Metro Council. We will be meeting tomorrow at 6 o'clock on WebEx, and it's one of many things that we'll be discussing, and I appreciate you bringing attention to it. Thank you.
You're quite welcome. And for the listening audience, anyone that has a question, please call 615-862-7777. That's 615-862-7777. Or you can go to the website, covid19.nashville.gov. covid19.nashville.gov. Any other comments? There being none, the meeting is now adjourned. Thank you.